Indications: LUMRYZ, sodium oxybate for extended-release oral suspension, is a prescription medicine used to treat the following symptoms in patients 7 years of age and older with narcolepsy: sudden onset of weak or paralyzed muscles, cataplexy; excessive daytime sleepiness, EDS. Please see important safety information, including boxed warning, at the end of this video.
My name is Katie, and this is my narcolepsy story. My onset started in high school. I was in marching band, orchestra, concert band, and robotics. I had a part-time job, and so I had been running myself ragged, doing every activity possible. So I don't think anyone thought twice that I was maybe getting burnt out a little bit and sleeping more my senior year. I was not recovering from that burnout. I kept getting sleepier. It became this voice I couldn't ignore telling me, I need to go to sleep. I'm too tired to be here right now. I'm not missing these activities because I'm not interested in them anymore. I'm missing these activities because my body's telling me I have no choice but to sleep. I saw an ad come up on TV and it was talking about excessive daytime sleepiness. And I was like, no way. We set up an appointment with a sleep specialist. I was kind of done advocating for myself. I'd fought this fight. I'm gonna let someone else fight it for me. And it was just medication after medication. I had a nurse practitioner for one of my appointments, and she's like, why haven't you tried twice nightly sodium oxybate? I was like, absolutely, I'll try. But it's extremely rare that I could wake up on time to an alarm going. When I would wake up realizing I hadn't taken that second dose, I had to start crunching numbers. What time is it now? If I take the dose now, will I wake up in time for class? Or do I skip this dose to ensure I can wake up on time, but I'm probably not gonna make it through to my afternoon classes? When I missed my second dose, I'm drifting off, I'm losing focus, I'm nodding off in class. When I was taking twice nightly, it felt like a me problem. Like I hadn't found the right alarm. I hadn't tried hard enough. You start losing hope as you realize like, oh, maybe there isn't a treatment for me. Maybe I just have this thing and I have to live with it exactly as it is from here on out. Once I got onto LUMRYZ, I could see that hope again. Once at bedtime, LUMRYZ for me means I go to sleep and the only thing I have to think of is what I'm gonna be doing the next day. I'm not exhausted. I'm awake enough to do things like make myself breakfast. It wasn't until maybe 6 or 7 months on LUMRYZ that I genuinely realized that my commute was 20 minutes. That's how much it was impacting me to drive while sleepy. With LUMRYZ, I'm ready to get to class. Feeling awake in class for me means being able to participate. I'm learning about things I really enjoy. I'm not having an internal conversation with myself trying to stay awake. That was just my experience. Yours may be different. You should definitely go talk to a healthcare professional for any questions you have. Since taking LUMRYZ, because I am more awake during the day, I am able to bring up the next generation of robotics kids. If someone out there is struggling, I would tell them that it's not something that you have to deal with on your own. I want to tell people that there are options. This is not a hopeless situation.
Indications: LUMRYZ, sodium oxybate for extended-release oral suspension, is a prescription medicine used to treat the following symptoms in patients 7 years of age and older with narcolepsy: sudden onset of weak or paralyzed muscles, cataplexy; excessive daytime sleepiness, EDS. Important safety information. Warning: taking LUMRYZ, sodium oxybate, with other central nervous system CNS depressants, such as medicines used to make you fall asleep, including opioid analgesics, benzodiazepines, sedating antidepressants, antipsychotics, sedating anti-epileptic medicines, general anesthetics, muscle relaxants, alcohol, or street drugs, may cause serious medical problems, including trouble breathing, respiratory depression, low blood pressure, hypotension, changes in alertness, drowsiness, fainting, syncope, and death. The active ingredient of LUMRYZ, sodium oxybate, is a form of gamma-hydroxybutyrate, GHB, a controlled substance. Abuse or misuse of illegal GHB alone or with other CNS depressants, drugs that cause changes in alertness or consciousness, have caused serious side effects. These effects include seizures, trouble breathing, respiratory depression, changes in alertness, drowsiness, coma, and death. Call your doctor right away if you have any of these serious side effects. Because of these risks, LUMRYZ is available only by prescription and filled through certified pharmacies in the LUMRYZ REMS program. You must be enrolled in the LUMRYZ REMS to receive LUMRYZ. Further information is available at www.lumryzrems.com or by calling 1-877-453-1029. Do not take LUMRYZ if you take or your child takes other sleep medicines or sedatives, medicines that cause sleepiness, drink alcohol, or have a rare problem called succinic semialdehyde dehydrogenase deficiency. Keep LUMRYZ in a safe place to prevent abuse and misuse. Selling or giving away LUMRYZ may harm others and is against the law. Tell your doctor if you or your child have ever abused or been dependent on alcohol, prescription medicines, or street drugs. Anyone who takes LUMRYZ should not do anything that requires them to be fully awake or is dangerous, including driving a car, using heavy machinery, or flying an airplane for at least 6 hours after taking LUMRYZ. Those activities should not be done until you know how LUMRYZ affects you. Falling asleep quickly, including while standing or while getting up from the bed, has led to falls with injuries that have required some people to be hospitalized. LUMRYZ can cause serious side effects, including the following: breathing problems, including slower breathing, trouble breathing, and/or short periods of not breathing while sleeping, for example, sleep apnea. People who already have breathing or lung problems have a higher chance of having breathing problems when they take LUMRYZ. Mental health problems, including confusion, seeing or hearing things that are not real, hallucinations, unusual or disturbing thoughts, abnormal thinking, feeling anxious or upset, depression, thoughts of killing yourself or trying to kill yourself, increased tiredness, feelings of guilt or worthlessness, and difficulty concentrating. Tell your doctor if you or your child have or had depression or have tried to harm yourself. Call your doctor right away if you or your child have symptoms of mental health problems or a change in weight or appetite. Sleepwalking. Sleepwalking can cause injuries. Call your doctor if you or your child start sleepwalking. Tell your doctor if you or your child are on a salt-restricted diet or have high blood pressure, heart failure, or kidney problems. LUMRYZ contains a lot of sodium, salt, and may not be right for you. The most common side effects of LUMRYZ in adults include nausea, dizziness, bedwetting, headache, and vomiting. Your side effects may increase when you take higher doses of LUMRYZ. The most common side effects in children include nausea, bedwetting, vomiting, headache, decreased weight, decreased appetite, dizziness, and sleepwalking. LUMRYZ can cause physical dependence and craving for the medicine when it is not taken as directed. These are not all the possible side effects of LUMRYZ. For more information, ask your doctor or pharmacist. Call your doctor for medical advice about side effects. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please see full prescribing information, including boxed warning and medication guide, available at LUMRYZ.com.